There is a mineral your body cannot function without. It controls over 300 biochemical reactions inside you right now. Your heart rhythm, your muscle contractions, your nerve signals, your sleep cycle, your stress response, your blood pressure, your blood sugar, all of it depends on this one compound being present in sufficient quantities. And 80% of the population is deficient in it, not slightly low, clinically deficient, running on empty, day after day, year after year, without ever being told why they feel the way they feel. The symptoms of this deficiency read like a list of the most commonly diagnosed conditions in modern medicine: chronic anxiety, insomnia, muscle cramps and spasms, migraines, fatigue that sleep does not fix, heart palpitations, high blood pressure, brain fog, depression, constipation, restless legs at night. Every single one of those symptoms has a pharmaceutical solution: a pill for the anxiety, a pill for the insomnia, a pill for the blood pressure, a pill for the migraines, a diagnosis for the fatigue, a referral for the heart palpitations. The average American with this mineral deficiency is not told they have a mineral deficiency. They are given 5 separate diagnoses and 5 separate prescriptions. The mineral is magnesium, a supplement that costs less than 15 cents a day. And the pharmaceutical industry, generating hundreds of billions of dollars annually from the symptoms of its deficiency, would very much prefer you never made that connection. This is that story. Welcome. To understand why magnesium matters this much, you have to understand what it actually does inside the human body. Magnesium is a cofactor, a helper molecule, for more than 300 enzymes. An enzyme cannot complete its job without its cofactor present. Remove the cofactor and the reaction stalls. The system breaks down. Think of magnesium as the key that starts the engine of your cellular chemistry. Without the key, nothing runs properly. Here is what those 300 enzyme reactions control. Energy production. Every cell in your body produces energy through a molecule called ATP, adenosine triphosphate. ATP cannot be activated without magnesium. Without magnesium, your cells cannot produce energy efficiently. This is why magnesium deficiency presents first as fatigue. Not tiredness from exertion, but a deep, persistent exhaustion that no amount of sleep seems to fix. Protein synthesis. Your body builds and repairs tissue using proteins. Protein synthesis requires magnesium at multiple steps. Without sufficient magnesium, repair and recovery slow down. Muscles take longer to heal. Tissue damage accumulates. Nervous system regulation. Magnesium acts as a natural calcium channel blocker. It sits at the receptor sites in nerve cells and prevents them from being overstimulated. When magnesium is low, nerve cells fire more easily and more frequently. The result is heightened anxiety, hyperreactivity, difficulty calming down, and in severe cases, muscle spasms, tremors, and seizures. Sleep regulation. Magnesium activates the parasympathetic nervous system, the rest and recovery state. It regulates melatonin and GABA, the 2 primary compounds that govern sleep quality. Without adequate magnesium, the body struggles to shift into deep sleep. You may fall asleep, but wake up unrefreshed. The architecture of your sleep is disrupted at the neurochemical level. Blood pressure regulation. Magnesium relaxes the smooth muscle lining of blood vessels. When magnesium is low, blood vessels constrict. Blood pressure rises, the heart works harder. Over years and decades, this contributes to cardiovascular disease. Blood sugar regulation. Magnesium is required for insulin to function properly. Insulin resistance, the precursor to type 2 diabetes, is strongly associated with magnesium deficiency. Multiple studies have shown that increasing magnesium intake improves insulin sensitivity in deficient populations. This is one mineral, controlling all of this simultaneously. And 80% of people do not have enough of it. The question that should follow immediately is, why? If magnesium is this essential and deficiency is this widespread, why are so many people chronically low? The answer has 2 parts. One is modern agriculture, the other is modern medicine's response to what agriculture created. Magnesium occurs naturally in soil. Plants absorb it through their roots. When you eat those plants, or eat animals that ate those plants, you absorb magnesium into your body. For most of human history, this system worked. Then, in the mid-20th century, industrial agriculture changed the chemistry of the soil itself. The widespread adoption of synthetic nitrogen, phosphorus, and potassium fertilizers, the NPK system, dramatically increased crop yields. Farmers could grow more food per acre than ever before. The system was celebrated as a triumph of modern science. What the system did not replace was the trace minerals the crops were pulling from the soil: magnesium, zinc, selenium, boron, chromium. Every harvest removes minerals from the soil. Traditional farming replaced them through composting, crop rotation, and fallow periods. Industrial farming replaced nitrogen, phosphorus, and potassium, the nutrients that make plants grow large and fast, and left the trace minerals behind. Over decades of intensive monoculture farming, the magnesium content of the soil dropped dramatically, and as the soil became depleted, the food grown in it became depleted too. A study comparing the mineral content of fruits and vegetables in 1950 versus 1999 found that magnesium content had declined by up to 50% across multiple food categories. The spinach your grandmother ate contained twice the magnesium of the spinach you ate last week. The broccoli, the almonds, the black beans, all of it significantly lower in magnesium than the same foods grown 50 years ago. At the same time, the modern diet shifted toward processed foods, refined grains, and sugar, all of which contain almost no magnesium and actively deplete whatever magnesium the body has stored. The result is a population eating more food than any generation in history and simultaneously running lower on this essential mineral than any generation before industrialization. The body sends signals when this happens, signals we have been taught to interpret as diseases rather than deficiencies. In 2023, the global pharmaceutical market for anxiety disorders was valued at over $11 billion. The insomnia treatment market exceeded $5 billion. The migraine treatment market crossed $4 billion. The antihypertensive drug market, blood pressure medications, exceeded $30 billion. The market for type 2 diabetes treatments exceeded $60 billion. These are not separate industries, they are separate product lines for a shared underlying condition that the industry has no financial incentive to address at its root. Magnesium deficiency does not have a patent. A mineral that has existed since the formation of the earth cannot be owned by a corporation. There is no proprietary formulation that generates licensing fees. There is no delivery mechanism that creates brand exclusivity. Magnesium glycinate, one of the most bioavailable and well-researched forms of magnesium supplementation, costs approximately $12 to $15 for a month's supply at standard doses, less than 50 cents a day, often far less when purchased in bulk. A daily magnesium supplement addressing the root deficiency generates perhaps $15 in revenue per patient per month. A patient managed across 5 separate pharmaceutical categories: anxiety medication, sleep medication, blood pressure medication, migraine medication, and a diabetes management drug, generates thousands of dollars in annual pharmaceutical revenue. The math is not subtle, and neither is the incentive structure it creates. Here is what the research actually shows, and this is the section the pharmaceutical industry funds considerable lobbying to keep out of mainstream clinical guidelines. A meta-analysis published in the journal Nutrients in 2017 reviewed 18 randomized controlled trials on magnesium supplementation and anxiety. The conclusion was that magnesium supplementation was associated with a significant reduction in subjective anxiety measures across multiple study populations. A study published in the Journal of Research in Medical Sciences found that magnesium supplementation significantly improved insomnia, severity scores, sleep efficiency, sleep time, and early morning awakening in elderly participants with insomnia. Research published in the journal Magnesium Research found that magnesium supplementation reduced the frequency of migraine attacks by over 40% in deficient patients, comparable to several prescription prophylactic migraine medications. The American Journal of Clinical Nutrition published data showing that higher magnesium intake was associated with significantly lower blood pressure, with each 100 mg per day increase in magnesium associated with measurable reductions in both systolic and diastolic readings. Multiple studies in diabetes care and related journals have confirmed the relationship between magnesium status and insulin sensitivity, with supplementation in deficient populations producing meaningful improvements in blood glucose control. The evidence is not emerging or preliminary. It is decades old, consistently replicated, and published in peer-reviewed journals that every physician has access to. What it is not is profitable. A prescription for magnesium glycinate generates almost no revenue for the pharmaceutical supply chain, no physician compensation tied to prescribing volume, no pharmacy margin on a generic supplement, no insurance reimbursement creating a billing relationship. The system is not designed to deliver this information to patients. It is designed to deliver prescriptions. There is a second layer to why this information stays buried, and it lives inside how medical education is funded. Medical school curricula dedicate an average of less than 20 hours to nutrition across 4 years of training. Nutrition biochemistry, the study of how specific nutrients affect specific physiological systems, is treated as peripheral to clinical medicine. Pharmaceutical companies fund a significant portion of continuing medical education. They sponsor the conferences where physicians update their knowledge. They fund the research that produces the clinical guidelines doctors follow. They employ the detail representatives who visit physician offices and explain which medications to prescribe for which symptoms. There is no equivalent infrastructure for mineral supplementation. No sales force visiting physician offices to explain the connection between magnesium deficiency and the 5 most common complaints in their waiting room. No sponsored conference sessions on the RDA discrepancy between official recommendations and the amounts research suggests are actually optimal. The recommended dietary allowance for magnesium set by official bodies is between 310 and 420 milligrams per day, depending on age and sex. Research suggesting optimal levels for specific health outcomes often points to 400 to 600 milligrams. Many people are consuming less than 200 milligrams through diet alone. That gap between what people are getting and what the research suggests they need is where the pharmaceutical industry operates, selling solutions to the symptoms that gap creates. Now here is what you can actually do and what the research supports. First, the forms matter enormously. Not all magnesium supplements are created equal, and the differences affect how much your body actually absorbs. Magnesium oxide, the cheapest and most common form found in drugstore multivitamins, has a bioavailability of approximately 4%. That means for every 100 milligrams on the label, your body absorbs roughly 4 milligrams. It passes through the digestive system largely unused and acts primarily as a laxative. Magnesium citrate has a bioavailability of approximately 16 to 20%, significantly better than oxide and widely available. Magnesium glycinate, magnesium bound to the amino acid glycine, has bioavailability between 80 and 90% and is the form most consistently used in research on anxiety, sleep, and neurological function. Glycine itself has calming properties, making this form particularly effective for sleep and stress applications. Magnesium malate is well absorbed and particularly associated with energy production and muscle function, useful for fatigue and exercise recovery. Magnesium threonate is the only form shown in research to cross the blood-brain barrier efficiently, relevant for cognitive function, brain fog, and mood. The research-supported dosing for most adults seeking to address deficiency is between 300 and 400 milligrams of elemental magnesium per day from a high bioavailability form. The elemental amount is what matters, not the total weight of the compound on the label. Start at 200 milligrams and increase gradually over 2 to 3 weeks. Moving too quickly can cause loose stools as your body adjusts. Take magnesium in the evening. Its activation of the parasympathetic nervous system and GABA receptors makes evening dosing particularly effective for sleep quality, and sleep improvement is often the first change people notice, frequently within the first week. For magnesium through food, the research-supported highest dietary sources are pumpkin seeds, dark chocolate, almonds, spinach, black beans, avocado, and whole grains. These remain valuable sources even given the soil depletion issue, and dietary magnesium is always preferable to supplemental magnesium when obtainable in sufficient quantities. The timeline for noticing effects from supplementation is typically 2 to 4 weeks for sleep improvement, 4 to 8 weeks for anxiety reduction and blood pressure effects, and 8 to 12 weeks for more complex metabolic changes, including blood sugar regulation. This is not a rapid pharmaceutical intervention. It is restoring a baseline that should never have fallen in the first place. The honest limitations deserve the same space as the benefits. Magnesium supplementation will not resolve anxiety caused by trauma, life circumstances, or clinical psychiatric conditions that require professional care. It will not substitute for medications that have been prescribed for serious cardiovascular conditions. It will not reverse established type 2 diabetes without accompanying dietary and lifestyle changes. If you are taking medications for any of the conditions discussed in this video, blood pressure, blood sugar, anxiety, or seizures, consult with a physician before adding magnesium supplementation. Magnesium interacts with several medication classes, and the interaction can be clinically significant. What magnesium supplementation can do, supported by the research, is address the physiological floor that deficiency creates. Restore the baseline functioning of the nervous system, the cardiovascular system, and the metabolic system to the level they were designed to operate at when this mineral is present in adequate amounts. For a significant portion of the population experiencing the symptoms described in this video, that restoration alone produces changes they have been seeking from 5 different prescription bottles, not because magnesium is a miracle compound, because deficiency was the problem all along, and deficiency has a simple answer. Now consider what the numbers actually represent. 80% of the population clinically deficient, a supplement costing less than 50 cents a day to correct it. Decades of peer-reviewed research confirming the connection between deficiency and the most common symptoms driving pharmaceutical prescriptions. And a pharmaceutical industry generating over $100 billion annually from those same symptoms, with no financial incentive to point patients toward a $15 monthly solution. The research did not disappear. It was published in journals that physicians read. It was presented at conferences. It was replicated across decades and populations and countries. What happened is that the system surrounding clinical medicine, the funding structures, the education infrastructure, the prescribing incentives, the insurance billing systems, was built to deliver drugs, not minerals. A patient who corrects their magnesium deficiency and watches their anxiety reduce, their sleep improve, their blood pressure drop, and their energy return is not a more profitable patient. They are a less profitable one. The system was not designed for them to have that outcome. Your grandparents ate food grown in soil that had not yet been stripped of its minerals. They had magnesium in their diet that you do not. They did not have the anxiety epidemic, the insomnia epidemic, the blood pressure epidemic at the same scale. Not because life was less stressful, because the nutritional floor their bodies operated from was intact. That floor was removed one harvest at a time over 50 years of industrial agriculture, and the pharmaceutical industry built its most profitable product lines on the symptoms that followed. A $15 bottle of magnesium glycinate does not fix industrial agriculture, but it does restore something your body has been running without, and that your biology was never designed to manage without. The symptoms were real, the deficiency behind them is real, and the solution has been sitting on a supplement shelf for less than the cost of a single copay. If this changed how you understand what your body has been trying to tell you, share it with someone who has been handed a prescription for something this video just explained. Subscribe. The next file opens soon, and what is inside it is heavier than what you